Hello, my name is Birthe and I'm a surgeon from Denmark. I've been looking forward to make this presentation for you. I'm going to tell you about how we have established a nurse-led clinic to treat late complications after colorectal and anal cancer surgery. First of all, I would like to tell you why I think it's necessary to have these late complication clinics after colorectal and anal cancer. And there is three reasons. One is that the patients who have late complications, they are affected very much on their quality of life, and it has big impact on their daily living and their social life. And two, we don't have enough patient information about these late complications. I think that's because we don't have enough knowledge about which late complication can we expect after this surgery. And that's why in our clinic we collect data to in the future better could tell the patient what they can expect. And three, we think there needs more treatment guidelines, and we have made a basic treatment guideline how you can treat late complication, because we think if it's easy or if you know how to treat the patients, it's easier to ask them about late complications. And now I will tell you about how our clinic operates. And we have clinic open 2 times a week, and we have always one of our 3 experienced nurses in the clinic. And every second week we also have either a surgeon or a gastroenterologist, and we also have a dietitian, and we use her whenever needed. And the way we find the patients is that every patient who have colorectal or anal cancer surgery at our hospital, they are invited to answer patient reported outcome measurements, and they have the first questionnaire 3 months, and then 6 months, 12 months, 24 months, and 36 months post-operatively. And we ask the patients about many different symptoms. All patients are asked about bowel function, quality of life, depressive symptoms, fatigue and nutrition, physical activity and social contact. Furthermore, the patients who has large surgery in the lesser pelvis are asked about pain, sexual function and urinary function. In the end of the questionnaire, it's possible for our patient to click if they want contact to the late complication clinic. And if they want that, they are contacted by telephone by one of our nurses, and the treatment will start in the telephone. Some patients only need this one consultation, and there is a clarification of the problem, or they will have a new appointment either in our outpatient clinic or a new telephone follow-up. Until now, we have invited almost 1,000 patients, and most of them have answered yes to participate in the questionnaire. And because we are enrolling new patients all the time, there will be some patients who are waiting for answer, and that's natural because we have new patients all the time. And as you can see, a lot of the patients want contact to the clinic, and the more extensive surgery, the more patients want contact. So patients treated for anal cancer, either by surgery or chemoradiation therapy, 75% of the patients want contact. And for rectum cancer, the patients who are treated for rectum cancer, it's 53%, and for colon cancer, it's 45%. So yeah, I think it's a lot of the patients who actually have late complications and want treatment for it. And we have looked at the first 390 patients we had in the clinic, and as you can see, most of the patients have bowel dysfunction, and that is not surprisingly because we are doing surgery on the intestine and on the rectum, um, but they have also other late complications, such as urinary dysfunction, different psychosocial problems, pain, sexual dysfunction, and neuropathy, and fatigue or stomach problems. So it's a large array of different symptoms. And in our clinic, we start treatment for every symptoms, no matter what it is. Of course, some of the symptoms we don't know much about, and then we have collaborators that we can refer the patients to. And just to let you know what kind of problems is it that the patients have, I have some statements from our patients. So one 72-year-old man, he said that I have to wear a diaper at night and use sanitary pads during the day. And I always carry spare clothes with me when I go out. Another one said, in my first week at work, I had 3 accidents. So I stopped eating food from 6 p.m. to 1 p.m. And that's because if you don't eat food, then you don't have to pass stool. Another one, he was a technician driving around to customers. He said, I have noted down all the public toilets on my route. And again, that's very common for our patients. They know every public toilet in their in the area they live in. Another one said, when you wipe yourself all the time, your bottom becomes completely sore. It hurts like crazy and you can't sleep or sit down or do anything. So these statements are very common for our patients, and as you can see, it feels very much in their daily living, and they have to think about stool and when to pass stool and where can I pass stool and do I have spare clothes with me. So they think a lot of stool, and it's a huge problem for them. And how we manage or how we treat the patients is that every patient has basic treatment. We use our basic treatment guideline, and if the basic treatment does not have effect on the patient, they are referred to one of the specialists we cooperate with. And again, if a patient has a complex problem, which means that they have more than one symptom and it's difficult for us to treat every symptoms because there's a lot of symptoms, then we do have some multidisciplinary team conference where we discuss the patients and we invite the specialist who is needed. And if some patients have very rare problems, then we discuss the patients with our national and international collaborators. And we have some collaborator agreements, and we use especially the urologist and gynecologist, and also the sexologist, dermatologist, psychiatry, and the anesthesiologist. We use their competences and we refer patients to them, and we have a very good collaboration. And I think that's very necessary when you treat these patients because they have a very different symptoms, and some of the symptoms we can treat by ourselves, but a lot of symptoms we also have to refer to other specialists. So this was my talk. It was time limited, and I hope there'll be some questions, maybe some discussion. I think it's interesting to hear what you do in your countries, and also if you have more questions, you're welcome to contact me by email or by telephone. So thank you very, very much for listening.